The word Idhini is Swahili for consent or approval, and it also happens to be the DNA of our company. Hello, ladies and gentlemen. My name is Trevor Alexander, and along with my co-founder, Gerard Charlot, we are building a digital health platform that rewards people of color for increasing their health literacy and interactions with clinical trials. To explain the importance of this, I would love to begin with a few stories. Mr. Anthony Dargan. Mr. Dargan is a well-educated man from Baltimore County, Maryland. Mr. Dargan worked as a professional for 40 years. Mr. Dargan was also diagnosed with cancer. At the recommendation of his doctor, he decided to enroll in a clinical trial. Then things went left. The test drug resulted in complications. Unfortunately, Mr. Dargan passed away on June 14th. Neither Mr. Dargan nor his family had enough information to make a sound decision on the trial. Now imagine if your brother, your uncle, your son, dad was used as a guinea pig for 40 years, causing direct harm to your family, both physically and mentally. How would that make you feel? Better yet, if your sister, your daughter, your mom experienced a knot in her womb, so she decided to get tests done at a renowned research university, only to have her cells extracted, sold across the globe, generating trillions of dollars, and your family had no idea for 25 years and was never fairly compensated to this day. How would that make you feel? It is no surprise that clinical trials overwhelmingly fail to represent diversity. Not only is it a big problem, it's an expensive problem. $421 billion is the price tag that our economy pays for health disparities. Furthermore, the demographics here in America are shifting. By the year 2045, 51% of our country will be people of color, only further highlighting why diversity in clinical trials is very important. Drugs must be tested on the people that they will be used on. Our solution is a community-based, patient-centric digital health platform that addresses some of the key barriers to enrollment. Trust, health literacy, a total lack of awareness in the communities, incentivization, transportation, and also an expert feedback loop for when users do enroll into the trials, in-house experts to guide them during, before, and after. The power is all in the community. Why community? It is the most effective way to build rapport and drive awareness. It all begins right here in the middle, the user. Our user relies on their three pillars of trust: their places of worship, the 107 historically Black colleges and universities that they get educated at, and the D9, which are the Black fraternities and sororities with a collective membership of 3 million people. It's the best of the best. Our influence in the D9 ranges from the White House to Congress to sports to media. Our solution provides the infrastructure, the intelligence, and the engagement for the healthcare ecosystem around them, providers, regulators, etc., to have access to this demographic. Our team directly reflects these pillars of trust. We've attended and graduated from HBCUs, we have places of worship, and we reflect the D9. Furthermore, we have the credentials and experience across business, technology, biotech, and community development to get the job done. $50 billion is the patient enrollment market, with $18 billion of that here in the United States alone. We believe that we can capture $850 million over the next 10 years of that market right there in the green. If that sounds a little small, it is. We use the conservative bottom-up approach of $2,000 per referral into a clinical trial. Current industry rate is $6,500, and it's even more expensive if somebody has dropped out of a trial trying to replace that person. Eventually, we will scale up to meet these numbers one-to-one. Our business model is simple. We make money three ways. We refer patients into clinical trials, We allow companies to utilize our rich data sets, or we use a licensing fee for them to integrate their technology into ours. On this list are some of the current best recruitment strategies used in industry. Our solution captures nearly all of them. But where we differentiate is the trust within the communities. Health is so sensitive. There's a lot of players in this space, but a majority of them do not have the embedded trust, the authentic trust to really move this demographic. Our traction to date, we built out our community MVP. We have 500 beta testers signed up for the platform. We've engaged in strategic partnerships with contract research organizations, and we've secured new team members. Our growth strategy, by the end of Q4 this year, we will continue to grow our community to 5,000 users. We will run pilot programs with contract research organizations, which are instrumental in doing some of the trial management work. And we will continue to bid out the platform and also access with regulators. Our ask for today is $500,000 for 6 to 9 months of funding. And this will be used primarily for product, marketing, and business operations. Join us. Let's create trust, transparency, and equity in healthcare together. I would like to thank the NetSkew team and its partners for giving us this opportunity today. Thank you.